On Thursday, Healthcare.gov posted its biggest enrollment day since the Affordable Care Act exchanges opened in 2013. More than 670,000 people signed up for coverage ahead of the December 15th deadline for January 1st coverage, and that's despite the fact that about 1 million people had to leave their contact information as they couldn't get on the site. House Republicans have voted 56 times to repeal the landmark legislation, depending on whom you ask, and Senate Republicans say the only thing stopping them is the president's veto pen. But once Donald Trump is sworn in, congressional Republicans will be under intense pressure to make good on all the promises to block the tyranny of the individual mandate. While the replacement effort is underway, Republicans will risk aggravating up to 30 million people who are covered by the law or who buy policies with prices affected by its insurance marketplace. Democrats will be sure to accuse the GOP of threatening the health care of millions. Senate Republicans can circumvent a filibuster by using a procedure called reconciliation to repeal parts of the law that affect the federal budget, like the individual mandate, health insurance subsidies, and Medicaid expansion. But health analysts and health provider groups are warning that repealing major pieces of the law without immediately replacing them could cause a collapse of the individual market that currently covers around 20 million people. And many of the law's most popular provisions can't be repealed using reconciliation, including guaranteed coverage of pre-existing conditions, which used to prevent millions of Americans from getting affordable health insurance. Recent polling shows 2/3 of Americans want to keep this part of the law. Even Trump has started dialing back the rhetoric. It's political suicide, which means they have to find some way to save the individual market, even with the pre-existing conditions provision in place. Without the individual mandate in place, millions of healthy Americans will opt out of health insurance. And that would be disastrous for an industry that spent hundreds of millions of dollars lobbying Congress. Senator Schumer says it reminds him of the story about the dog who caught the bus. If you found the information in this video helpful, go ahead and share it with a friend, and don't forget to click on the subscribe button so you can find us again next week.